This is Mark Durand-Duche with part 2 of our video series, Do You Really Need Medigap Insurance? In part 1 of the video, we shared about a 68-year-old wishing to leave his Medicare Advantage plan in order to go back to original Medicare. He believed he could gain access to a special cancer treatment center that was considered out of network for his current Advantage plan. And that is a hallmark of original Medicare. You have greater control, greater choice of specialists. That's exactly why many people choose original Medicare in the first place. On average, nationwide, 98% of doctors accept Medicare patients. Yet shockingly, I told him not to do it. Don't go to original Medicare. Why would I say that in his situation? To answer this question, we need to understand that he signed up for his Medicare Advantage plan when he turned 65. Now he's 68. He did not use an independent agent. He went directly to the insurance plan. Lots of people do that. I doubt that he was told about his 1-year Medicare trial right. You see, by age 68, his trial right had expired 2 years earlier. So how does this work? If all the trial right conditions are met, Medicare provides guaranteed acceptance when you return to original Medicare and apply for a Medigap plan. The Medigap insurance company has to accept you. But he didn't meet those conditions. No one ever told him about it. And that's the downside of not using an independent agent. Therefore, if he were to use his annual enrollment period to disenroll from his Advantage plan, like he wanted to do, and return to original Medicare, in order to get the Medigap plan, now he had to answer health questions. Well, he also has to disclose his cancer diagnosis. And he realized they weren't going to say yes. But it could have been worse. Imagine if he had gone back to original Medicare not knowing this, found out later that his Medigap application was declined. Can you imagine paying 20% of chemotherapy? That could use up your savings very quickly. And that's why, sadly, I had to tell him not to proceed. So I promised you in the first video to discuss Medicare Part A hospital expenses. I know some of you are wondering if you can avoid Medigap completely. That's why you're watching this series. And maybe just survive on traditional Medicare Part A and Part B. So let's use our 68-year-old as an example. Let's pretend he ignored my advice, proceeded and went back to original Medicare. How would that have worked for him? Well, we know he's going to be paying the 20% for Part B expenses. But with Part A, if you've ever seen a benefit summary or read the booklet from Medicare, Medicare and You, it will say Medicare Part A, hospital services, per benefit period. Now, per benefit period is an interesting choice of words, because if you look at the Part B headline for non-hospital services, you'll realize it says per calendar year, and that's what most of us are used to. But with hospital Part A, Medicare treats everything per benefit period. So the implication is you could have multiple deductibles in one 12-month period. In the first 60 days, you'll never have to pay more than the $1,556 deductible for your hospital confinement. That's for 2022, likely to be a little bit more in 2023. If you're still hospitalized after 60 days, from day 61 through the 90th day, you actually will start to have a daily copayment. That's $389. And after 90 days, well, this is where it's a little bit different. You don't get unlimited hospital coverage with Medicare. You get a 60-day lifetime reserve after that initial 90 days. What happens after the 60 days? Well, you're on your own. And so if this person had gone to original Medicare, could not get a Medigap, that was going to be his situation. So what is a Medigap do? Well, let's look at the Plan G. It's a very popular Medigap plan. With this plan, that lifetime 60-day reserve gets a bump by an additional 365 days, and there's no further copayment. So that's 365 hospital days plus the 60-day lifetime that you were already given. I would argue if that was the only thing your Medigap plan provided, it would be worth the premium just for that. So now do you understand why I told him not to return to original Medicare without a Medigap plan? I think this answers our main question of the video series. Do you really need Medigap insurance? I say absolutely yes, you do. Would you like me to be your local independent agent? There's no extra cost. Rates are the same with or without an agent, and agents don't charge fees because we're compensated by whichever insurance company we help you enroll with. If our real-life 68-year-old had talked to an independent agent when he first turned 65, there's a good chance he wouldn't be in this catch-22 situation now. So please get independent advice. If not from me, find another agent, but please do so. And if you found this video informative, subscribe to our channel and you'll get notifications when we have new video topics released. Thank you for watching.